Hello, I'm Dr. Richard Swift. I'm a board-certified plastic surgeon, and I would like to talk about male rhinoplasty. And I'd like to talk about the differences between a male rhinoplasty and a female rhinoplasty. And obviously we have the same anatomical structures, but the size and how we deal with these structures of the nose is what makes it a male or masculine rhinoplasty. So the goals are different. For a male rhinoplasty, we want to maintain a masculine traits and a masculine appearance versus women that want to have a female appearance to their nose. So a guy wants to often have a nose that will fit his face, not a small, dainty, upturned nose. So that leads us to our second point here. A male nose should remain larger, and you should not have a male face with a reduced nose to the point where it looks feminine. And that's going to be a giveaway that it's not a natural nose, and it's when it gives off a feminine appearance. Male rhinoplasties tend to be more conservative, the goals, than a female rhinoplasty. Another very important part of the nose anatomically is what we call the dorsum, this here, the bridge of the nose. And some guys, it's fractured, it has a prominence, it sits too high, and we have to straighten that. And here's like a model here showing what a straight dorsum would be in terms of the nasal anatomy. And it's interesting that a nose, maybe this upper third or half of the nose is made up of the bone, and the part we're not seeing here on this skeleton here is the cartilage. And we'll get to that. Okay. So what we want to do is for a male rhinoplasty is maintain or create a straight dorsum all the way down. There's something called a super tip break, a transition here. Some guys have it, but a lot of women, that's often a feminine trait that women want, is a super tip break. Some guys want it, but I would say a lot of men request a straight dorsum. So that's a distinction between often the female rhinoplasty. Another thing too is that men, I would not recommend rotating the nose, turning the nose up. And it's another female trait. So for male rhinoplasties, we don't rotate the nose. Another thing is the length of the male nose. You want to maintain a longer nose. The worst is for a guy having a nose shortened or rotated. And women often like this. It looks cuter and it's more feminine. So as guys, we don't want to do that. Another important aspect of the nose is what's called tip projection. And that's how much does the nose come off of the face. And that's an important thing. And it's certainly more of a male trait. And so I would say maintain the tip projection, whereas females, sometimes we have to recess it, like telescope it back in because it sticks out too far and it gives the image of a masculine nose. And let's just look a little bit at this model here. This is showing a model of someone who's had having a open rhinoplasty where an incision is made across this little column and the nasal skin is retracted, exposing, here's the septal cartilage right here, and this is the tip cartilage. In particular, this is called the lower lateral cartilage. And by trimming this cartilage here, you can narrow the tip. You can narrow the tip here, but also you can thin it out and make the nose not so bulbous or so round. But for a guy, you want to maintain this piece of cartilage on either side, enough adequate width and not make it too thin so that it still maintains this fullness that men want. And the last thing I'd really like to say is that for the male rhinoplasty, besides being conservative, consider the relationship between the nose and the chin. And by that I mean it's more masculine to have not only a chin that projects and is larger, but also to have a chin that matches. A smaller chin or a recessed chin is more feminine trait, and some women can get away with not having to put a chin implant in. But I would say for men, if they have a smaller chin in a relationship where it doesn't touch the lower lip, a line down like this, if it doesn't come up to that point, then consider putting in a chin implant at the same time as a rhinoplasty. And that the conjuncture between having a larger nose, and a chin that matches, those two work synergistically. So I like to say that if you're interested in this and have further questions, inquiry about male rhinoplasty, feel free to contact me. Thank you.